A day after Toronto Public Health confirmed 4 cases of measles, the debate about vaccination is rekindled and whether it should be mandatory.
Today, the province's health minister is urging people to get vaccinated for the illness. Marvel Turk joins us live now. Marvel, you spent the day at a pediatrician's office. What are parents telling you?
Well, the opinion on vaccination certainly mixed among the parents that I spoke with, but there is one thing for sure, that doctors are now answering a lot of questions from concerned parents about measles. Dr. Dina has had a lot of conversation about measles ever since Toronto Public Health confirmed an outbreak of the illness in the city.
Every single kid I've seen in the last 2 days, the parents have come in asking me questions about whether they should be getting vaccinated, how to prevent illness, what are the warning signs, lots of concern.
12-month-old Adrian is due for the measles, mumps, rubella vaccine, but his mother is on the fence.
I would just like to get more information on how accurate that stuff is and if there's a possibility of him having any neurological issues because of it.
Thousands of studies over the last 10-15 years have shown that not to be the case, and yet the myth still persists.
Health officials now find themselves advocating for vaccinations after a growing anti-vaccine campaign, including the province's health minister, who did his PhD in measles vaccination. Eric Hoskins says a 100% vaccination rate is ideal, but may not be necessary.
Get the vaccination rate in the community high enough so it creates what's called herd immunity. So when that virus is looking for a vulnerable host or a vulnerable person, it just makes it harder to find that person.
Measles is highly infectious. The virus can live on surfaces for as long as a couple of hours. Toronto Public Health says there are no links to connect the 4 confirmed cases of measles, so the search for the source will be challenging. Doctors say that will make it tough to prevent more cases.
And I could be walking by you in the street, cough, you won't even notice it, or I could be talking or laughing, sputum can come out, infect the air, you can breathe that in.
And Dr. Kulik adds a worst-case scenario here. She's telling her patients about, and that is roughly 1 in 1,000 kids who get measles will develop an infection of the brain that could cause seizures and even death in some cases.
So how long will someone be contagious before the symptoms show up, Maribel?
This is where the concerning part of the whole argument is that before those telltale red rashes and dots show up, someone could be contagious 4 to 5 days before becoming obviously infected. And so this is what has healthcare providers really worried, is how many people are now walking around out there who might be infected now.
Yeah, thank you for that, Maribel.
You're welcome.
We have more on this for you now. The resurgence of the virus in the U.S. also